Hello, hello, and welcome back to the Heal with Grace podcast. Today, we are talking all about what it means to predict our symptoms. And no, I do not mean you're doing that on purpose. You're trying to predict or it's all in your head. Nothing of that nature. We're just going to help you understand actually what's going on when we continue to have symptoms and how oftentimes we don't really recognize that we don't have them all the time because our minds are just so occupied with the pain and with the symptom that we forget that actually we don't have our symptoms all the time. And that's just one part of a larger conversation that we are having with one of my special guests, Dr. Michael Dow. He has actually been really helpful for me and my learning and connecting in Boulder and Colorado. He is a licensed psychotherapist and clinical psychologist with over 20 years of experience. He specializes in mindfulness-based therapies and pain reprocessing therapy, and his work focuses on the mind-body connection and healing chronic pain, trauma, and he works with couples and understanding the overlap between finding safety in relationships and finding safety in our nervous systems with pain. So I thought that was really interesting as well. There's a little bit of backstory as well with him in pain management versus pain treatment that I think y'all will find really helpful. So without further ado, let's just go ahead and jump right in. Hello, and welcome back to the Heal with Grace podcast. I have a wonderful guest here, Michael Dow. And before I go too far into it, I'll just let you introduce yourself. So,
Okay. Yeah.
hi, Michael. Thanks for being
Hi,
here.
Grace. Yeah, wonderful to be here. So, I'm Dr. Michael Dow, a psychologist here in Longmont, Colorado, and working with neuroplastic symptoms of all kinds is one of my passions and specialties. And I've been a therapist for almost 25 years and then got into this area about 7, 8 years ago. And I also like to do couples therapy, and we might talk about some of the connections there.
Yeah, definitely. Can you then share with us a little bit more around how you got into this specialty?
Yeah. Yeah.
I find this always interesting. I've talked about this before that a lot of times we get into this because of personal experience, right? Not all the time, but I think most of the people I know do that. And I also just forgot to name I'm in a group of yours in Boulder, a consultation group for
Yeah. Neat.
PRT, pain reprocessing therapy, neuroplastic symptoms. And it's been really great to connect. And we can talk about that a little bit later for all the therapists and coaches listening to this. But I think that this community is such a strong knit one. It's really interesting to be a part of. It's really cool to be a part of. So, with that, since this is not been your full career, yeah, how
Yes.
did you get into this?
Yes. Well, how do I summarize it in the most succinct way? And I will say, Grace, I think I might be unique in that I have personal experience with pain and recovery. And I kind of didn't realize that I did until I was already working with pain, which is kind of interesting. So I have this whole background in like Buddhist meditation and mindfulness, and then psychodynamic and psychoanalytic therapy and groups. Groups is one of my big focuses for years, and I still love groups. So I was running this integrated health clinic in Boulder through community mental health. So working with a lot of underserved people who are really struggling. And our whole focus was integrating therapists into healthcare settings. And there's a big need for that. And one of the big needs in healthcare settings is chronic pain. And I was working for Clinica Family Health in Boulder, and they have this huge need, the physicians do, for like, how do we help all these people with chronic pain? It is amazing and eye-opening how many other chronic symptoms show up in healthcare settings that doctors don't really know where it's coming from or how to work with. It's much more than people realize.
Uh,
So anyway, they asked me to help design their chronic pain program, and we designed a whole chronic pain management program based around cognitive behavioral therapy and groups. And I loved doing the groups, and people loved the groups, but nobody got out of pain. And we didn't even have that as a goal or like realize that that was a possibility until one year I had this intern walk into my office who said, "We have this treatment. I'm doing this research at CU Boulder, and we have this treatment that can get people out of chronic pain. We're doing it." And this was Yoni Ashar, and this was the Boulder Back Pain Study, which later became famous and the basis for this book, The Way Out, which is all about pain reprocessing therapy. So Yoni walked into my office and I was very skeptical. And he was a graduate student. He hadn't really done a lot of work with patients before. And I didn't really think too much of it. We gave him some patients to work with. And then at the end of the year, he came back and did a training with us, with all the staff at the mental health center on pain reprocessing therapy. And he brought in a patient who had like 30 years of pain, who had no pain. And she described her experience. And it was mind blowing for somebody who was working in that area. And I had never seen anybody get out of pain. I mean, not one person. And then in the middle of that training, um, we were doing the experiential exercises around somatic tracking, which I'm sure you've talked to your listeners about, where you try and attend to the sensations in your body from a lens of safety. And I realized that I was one of these people, that I had essentially chronic headaches, not as bad as the worst people. I mean, I was still holding a job and functioning, but I was having an incapacitating headache at least once a week,
Mm,
sometimes twice a week, sometimes 3 times a week. People have much worse situations than that, actually.
mm,
But I started to realize I have phobic relationship to these sensations. There was a kind of um, emotionally traumatic moment when they started some years ago. They're really fueled by stress and emotions that I don't want to have to deal with. And I had this like flash of like, this is me. I need to do this work, which was kind of weird because I'm a meditator. I'm interested in the unconscious and psychodynamic therapy, but I had never really thought to work with myself, or I didn't even think it was something that I could work with. Like, I just have to take pills for it.
mm,
And I just sort of have to suffer with it. I did probably right away have some chunk of improvement. And then it was over the course of like the next year or really couple of years of working with myself, doing some therapy myself, and then making some changes in my life. And which ultimately, a big change was leaving my job and doing this kind of work more full time. I was in a job where I was doing a lot. It was very stressful. And I was doing a lot of stuff wasn't my true love, like a lot of administrative paper crunching kind of stuff. And I was under a fair amount of threat, just because it was a very stressful time in healthcare during COVID, and a lot of people were really struggling, and it was getting directed towards me and other healthcare providers. And I totally understand, because it was a really hard time for people, but it was too much. It was getting to be too much for me. So now, fast forward, I think I first got exposed to this. I first met Yoni maybe 7 years ago
mm,
and got involved in pain reprocessing therapy. And then we started training people in it at the mental health center. And then I got involved in emotional awareness and expression therapy. And then about 2 years ago, I left my job and started doing private practice full time. And I should mention, Grace, I don't know if you know this actually. So my private practice is an LLC in conjunction with my wife, who's also an amazing therapist and who I've also learned a lot from. She's also trained at Naropa and does somatic body mind psychotherapy. And that's actually a whole nother discussion, like the whole history of somatic therapy and then pain reprocessing therapy and how they kind of intersect. So anyway, so my wife and I I'm here in Niwot. We have this practice here, and yeah. And my headaches I really feel like I'm recovered. Occasionally I do get, and I think it's important for people to know, like, what recovery looks like or what it means. Do you want me to talk a little bit about that? Or am
Yeah,
I
let's go to that. I think that and then I have a couple follow-up questions, but I think that's very important. Yeah.
it's hard to put a frequency on it, but when I am stressed, and especially if there's some emotional stress I'm dealing with, it does often show up for me in like tension in my head or neck. And I just have a very different relationship to it. I'm not really afraid of it, or certainly not as afraid of it. And I try and listen to it more and really catch it earlier and slow down and ask myself, like, what am I feeling? What am I not paying attention to? And it's often, for me, usually about doing too much and sort of being a little too much other focused and doing things like not paying attention to my no often.
Yeah. I think many people that experience chronic symptoms have that similar tendency. I mean, we know that from the different types of characteristics of your personality with people that experience chronic
Yes.
symptoms. Take on too much, other focused, harder ability to say no. And actually, as I went through my journey, I didn't really I never thought of myself as that. Never fully thought of myself as someone who's always giving and always other focused, but there's a spectrum, right? And then someone pointed out to me even just they were like, "I mean, you're a therapist. You are other focused a lot of the time."
Right. Right.
Yeah, okay.
Yeah.
Yeah,
Just inherently being a therapist. Yeah.
exactly, yeah. But I wanna talk about that important distinction. You mentioned it a couple times, one in the beginning of understanding this work where you were working with pain management. And
Yes.
what we're really talking about here is I use the word treatment, but I don't even know if there's a better word necessarily, healing whatever that looks like, right? But there's a big difference because most of the world focuses on pain management, just living with it and learning how to manage the symptoms a little bit more. What we're really talking about here is actually getting out of those symptoms, not having to be perfect, right? But can really change that. So can you speak to that,
Yeah.
like the difference there?
Totally. Yeah, and I mean, as I've evolved with this, I think there is a place for pain management, but because people have all kinds of situations where they're not ready to do this work, but it is fundamentally there, and there's definitely overlap with pain management. And I think of this as like pain recovery or neuroplastic work
Okay, yeah.
or neuroplastic retraining, or it's different ways of saying it. But in some ways, there's a hard line. In some ways, there's a lot of overlap. But really, the difference is that it's more of a focus on getting people out of pain. And I really see recoveries that I wouldn't, not only didn't see before, but didn't know could happen. And so, even with some of this, there's all kinds of really great like acceptance and commitment therapy programs and somatic programs that are more focused around accepting pain and being gentle with yourself around pain and softening around it. And all of that is great and super helpful, I think, actually for most people. But we're sort of doing this little it's like the difference that makes a difference. And really, the more I do this work, Grace, the more I think it really is not just the vast majority, not just the vast majority, but it's like three vasts. It's like 95%, 99%. Like really most persistent pain, especially if it's lasted, more than a year, especially if people don't have cancer or an autoimmune disease, it's mostly in your nervous system, which means it's neuroplastic. It's something that you have learned you're not in control of. You can't just talk yourself out of it, but it can be unlearned. Some people will have a quicker journey than others. That's a whole other interesting area. It's like, what's the difference between people who can really get better quite quickly and then people who take longer? But when we're doing pain management, we're not shooting for that at all. It's more this message of there's something wrong with your body. You're always going to have to live with this, but we're really going to help you manage it and soften around it. And again, not to knock that, that can be helpful too, but it's different.
Yeah. I agree with you. Over time, the more that I've done this, I've reflected on not only the difference between those 2, but also how they go together. Because if we just focus on, "Oh, no, you can 100% heal and get out of your pain," then there can be pressure around it. And if it doesn't go according to plan, then there's disappointment and fear, which creates even more symptoms. So there really is, I feel like, a balance of the 2. And I think what we're talking about is there's more hope than just management. You really can release, decrease, whatever you wanna say, the pain, but throughout that, there is acceptance and management of it. Does that make
Yes.
sense? Yeah.
Yes. And I think just to throw this other piece in there, Grace, which you and I were talking about too, I've now gotten to this other level where I really think both based on the the research and the science in my clinical experience that people's pain is going away. It is turning off more than they realize. And because I've gotten fascinated about the whole science of predictive processing and predictive coding and how much of what we experience is not, we think of pain as being like it's like an input, just like we think of vision as being an input and all of our senses as being an input. But what we're learning about the brain is that it's much more of what we experience is based on these predictions, which themselves are based on past experience. So we predict if I move this way, it's going to cause me pain. And it's unconscious. We're not thinking about it, but we have these unconscious predictions that are shaping our experience. And when we have what they call like a prediction error, like you do something and the pain doesn't happen, which I think is happening more than people realize. But then what happens is we discount it and we think, again, and it can be unconscious, but we think like, oh, that doesn't really matter because I didn't have pain when I sat down that time, but that didn't really matter because I was distracted. The pain was there, but I was distracted. I've heard Howard Schubiner say this too, and I really think it's true, is that when people, I think there's more going on there than people realize. When you're distracted, it's, I think probably more what's going on is just that the pain is gone. That neural circuit isn't being activated, but in some way we're discounting that experience or not emphasizing it. So that's part of what I think in any kind of therapy that you're doing around pain. I think what I'm trying to do with people is create those experiences in the office where they have some interruption in their predictive loop and the pain is either less or than they thought or goes away. Again, I think it's easier to create that than people realize, but to create that, to have somebody be witnessed in that so they know that it's real, and then to help people create that outside the office in a very simple way. I think that's what I'm trying to do with folks.
Yeah. So, yes, okay, I love this so far, but can we back up and describe predictive processing a little bit more for people that don't fully understand it? What does that mean in terms of our symptoms or pain?
Yeah, well, I think it's just in a really simple way. We have anticipatory systems where we're anticipating or we've learned that more of what we experience is based on our prediction than based, like actually what's happened. The sensory input determines less of what we experience than we think.
Mm.
So there's a lot like we're just predicting if I move in this way it's going to cause pain. If I express this emotion it's going to be scary. If I relate to this person it's going to be conflictual. It's not just happening with pain, it's happening with all kinds of things.
Mm.
And then that shapes what we actually experience. And what we tend to think is that we're just this blank slate and we're experiencing things and it's not really like that. There is
Huh.
an excellent book on this, The Experience Machine. It's Andy Clark's book.
Okay, cool. Yeah. I mean, yes, I think that you are. And I think maybe a good example would be helpful of, I mean, kind of mentioned it, but especially people who have migraines or pain where you've had a certain experience of that happening before. Maybe it's a long car ride or a long day at work, right? And you end up having more symptoms. That's happened. And so you start to assume that's going to happen again. That's the prediction,
Right. Just,
right?
I mean, I can give a simple example, just like with my own headaches, because you always know, you notice it when you can interrupt it. I think. So
Mm-hmm.
like this was a couple weeks ago, maybe a couple months ago, and you don't always know why, but I was like with my daughter and we were going to, I think it was the stock show in Denver. And we just walked into the Coliseum there and there were just tons of people. And my daughter was a little bit like fussy or anxious or something. And she was starting to wander off and I could feel a headache coming on. And it was like my brain is predicting like I could just feel the whole predictive machinery starting to kick in. Like one of my triggers is being around a lot of people in a crowded space and feeling a little bit dizzy and overwhelmed. And then I'm trying to relate to someone that we're having a little tension. And so I interrupted it and I just stopped and just, even just closed my eyes, just held my daughter's hand and just reassured myself I mean, I was able to interrupt it before it got too bad, and I was quite far along in my recovery. So like earlier on, this would have been harder. And I just was like, I'm going to be okay. The sensations are safe to feel. There's nothing dangerous here. And I'm sort of interrupting that prediction of there's something dangerous. You're going to have conflict with your daughter. You're going to get separated. There are all these people here. So, I mean, that's just maybe a simple example. You can find lots of examples of how your prediction will shape your perception, just like you're expecting to see something and then you actually see that thing, even though it's different than what's actually there.
Yeah. I think there's another, I'm not sure if it's the complete circle as when we're talking about pain, but I mean, self-fulfilling prophecy is something that people
Self-fulfilling
understand,
prophecy. Yeah.
right? It very much so can happen on, I think, very many levels, which is what you're talking about. It happens so often, way more than we realize, not just about our body or symptoms, but about life, our relationships, ourselves.
Yeah.
We
The
predict
great
things all day long.
Totally. I mean, the great example that Howard Schubiner uses, if I can steal from him, maybe you've heard this one about when his wife would bring him an apple in the morning and she'd like bring him sliced apple and he was like had his eyes closed and she gave him a piece of sliced apple and he bit down in it and it tasted totally rotten until he opened his eyes and saw, oh, it's sliced peach. It's not sliced apple. So his brain was predicting apple and then interpreted that taste from that perspective. So it was like, oh, this is a really rotten apple. But actually, it's a really fresh, ripe peach. So, but the actual taste got all mangled because of his prediction. So that's another example.
Yeah. I also actually, I think it was last week released or a couple weeks ago released an episode about my own flare and my symptoms, which was so much about the fear that was built up around it. And I talked about that when I was in New Zealand. Of there was a lot of fear around this travel and this space and this time and everything that was happening. And yeah, it brought on some symptoms, and it happens. Yeah, it happens so much more. So okay. So can you speak to that then, how you're noticing that it does happen even with some of your clients or patients of, okay, you're noticing that this happens throughout their time, throughout their recovery time too?
Yeah, yeah. I
Yeah.
just want to make one point. I'm just thinking of, Grace, is that what we're talking about here is triggers. That's an
Yeah.
example of process. Except the key thing is that it's not the thing that's causing the reaction in you is not the thing out there. It's your predictive processing around it. Like it's not the actual apple that was causing the rotten taste. It's his prediction around it.
Yeah.
So
A really great I use food a lot with this
yeah,
because it's almost like such an easy thing to see of, "Oh, I ate this thing, it caused me these symptoms," and it happens a lot in this community where we get really intolerant with food and food sensitive, and it's hard to believe at first because there's so much rhetoric and information around there around what food is best for you or healthy for you or gonna change this about your body.
right.
Unless there's an I always say this, unless there's a true allergy, sensitivity that you've developed over time is much more about your predictive processing, your assumption about that food. And it's not, I want to say this too as we're talking about it, it is not your fault. It's not something you're making happen. It's not something you're trying to, yeah, do. It's your brain and your nervous system.
Yes. And it's not in your control. Like it's just that this is how the brain works. And a lot of people don't know about that.
Right.
Yeah.
Yeah.
Yes.
You've used the term people's symptoms turning on and off more
Yeah.
than they realize.
Yeah.
Can you speak a little bit more to that?
I just think of this one guy recently, and I'm always careful not to give too many details because it's confidential. But I mean, this can happen. This was literally the first session. He didn't know about the science of pain and predictive processing. And so part of it is just teaching him about that. And then and he had this neck pain. And so we just practiced like just turning what happens when you turn your neck. And so the pain turned on. We were turning our necks together and the pain turned on. And then we practiced giving some affirmations to his unconscious brain after he'd sort of had an orientation around like pain does not always equal damage. harm is different than hurt. So we just practice saying some things like, my neck is safe. There's nothing wrong with my neck. And his pain turned off and he turned his head and he had no pain. And he didn't remember turning his head without pain for 20 years. So you can hear that story and you can think that's some magic that Michael was doing. And that's sort of how he felt. He's like, how did you do that? Did you hypnotize me? Is that some magic that you're doing? And when I first saw uh, like Alan Gordon and some of these other people doing this kind of work, it seemed like it was magic. But it's not magic. And it's not like I'm some incredible therapist. I mean, I think I'm good, but it's not, it's really just that his pain is turning on and off more than he realized. And he had somebody witness it. His brain responded to that message of safety really well. But, the time was ripe for him to really get it. And he just got it. And in that moment, having me there to say, look, your pain turned off. Let's not discount that. That's your pain turning off. That means that your pain is neuroplastic. Because if you can turn your neck and you're not getting pain, that means there's nothing wrong with your neck structurally.
Yeah.
So that's like a simple example. I have other ones too, but and other ones where people, for all kinds of reasons, a lot of them really valid, have trouble making that. It's almost like a 10% shift to like see, oh, that counts that really counts. That means something.
Mhm. I think that piece, and you mentioned this earlier, where sometimes we forget to even acknowledge the times that we're not having symptoms or pain because we're so focused on the times that we do
Yeah.
and how that even plays a role in all of this.
Yeah.
Yeah.
I have another example for you if you want.
Okay. Yeah. Go for it. Examples are helpful, right? Often they're more helpful instead of us trying to explain it. At least for me, sometimes I notice I get into language that's not always understandable. Yeah.
This was from a friend of mine, and I don't know if he'll listen to this, but if he does listen to it, I'm not gonna out him. Really, really wonderful guy and very sophisticated, smart, super guy. But he's been having all this like stomach pain for years, really, and it comes and goes. He's on all different medications for GERD, acid reflux. Don't really help. But we were talking, and he said he noticed, and I was explaining this the fact that it turns on and off, it could be neuroplastic. And he was discounting that. And he thought, well, I don't know, it's turning on and off because the meds aren't working, or, he just wasn't thinking about that. And as we talked about it, he said, well, there was this time I went to my yoga class and I had pain before the yoga class. And then I really relaxed in the yoga class and the pain went away and I felt this sadness. And he's had a number of events that have happened in his life that have been really sad. And so when he described that, I was able to say to him, look, let's highlight that. Your pain turned off because I think it's not just random. It could be, but it sounds like it's because you relaxed into it. You weren't afraid of it and you felt the feeling that was underneath that. And so just my saying that and sort of highlighting it for him where he would normally discount that, and because he's a really smart, sensitive, sophisticated guy, he was able to start to sort of integrate that and say, and to start noticing it more. So it's not always that easy, but just another example.
Yeah. Well, and you touched on something there that I want to highlight that, and we actually were talking about this before, that sometimes reasoning, or our body and our nervous system's reasoning for holding on to the pain is usually something else, whether that is because we don't want to feel grief or there's something we're getting from it. And so sometimes when we're looking for all the ways that we have pain, it can be I don't really want to use the word distraction, but in a way, it's a distraction from actually what's underneath, right? For him, it seemed like this sadness that was happening. For other people, there can be an attachment to the attention that they're getting, in their pain and their illness. And that is not to say you're making it happen so you get attention. It's not in a ego way or a selfish way or anything like that. It's a very natural human way to receive our needs. So
Right. Right.
Yeah, so I guess what I'm asking here is, can you speak a little bit to maybe how that happens, how we end up in our symptoms that might be causing us, or not causing, but they're there for a reason than we realize.
I totally just want to emphasize, Grace, this is just part of being human. I mean, include myself in this, and it's not even like a pathology, really. It's just part of being human. That
Mhm.
we all have feelings that are hard to feel, that are scary. We all have, situations that are challenging. I think for myself, like with my own headaches, there was something. It wasn't so much sadness, but more like fear of being angry, maybe a fear of setting limits, maybe some kind of fear. I don't know if fear is the right word, but some kind of just like orientation towards not taking care of myself enough, or not being myself uh, fully. So I mean, it's sort of serving. Your question is like, how does pain serve a function for people? Is that what kind of what
Yeah.
you were asking?
Yeah.
So I mean, and again, none of this is conscious, but it can serve that function of like helping you not be yourself, or like the part of you that's like afraid of fully inhabiting the world and fully being yourself. And then from that position, you can sort of feel free to complain more, but be less powerful. And it's a little scary to step into your power and to step into like, no, this is what I want. But there can be all kinds of dynamics around it. I think another thing I keep coming back to in this work is I think it's very, very simple. It's very, very simple. And people are incredibly complex. And so the journey is very different for each person and very complex. And both of those are true at the same time. And like the
Mhm.
simple thing is that it's like our nervous system, pain, dizziness, fatigue, all this kind of stuff is our brain's danger system. And anything that your brain codes as dangerous, your brain predicts is going to be dangerous, like a movement, a sensation, an emotion, anything can trigger that alarm. And that's really, really simple actually as a model. Like it's much simpler than like you've got four different things wrong with you, and you've got this enzyme that's wrong and this thing that's wrong and this L4, like it's much simpler than all that. But the more I work with people, like everybody's journey and what's going to click for somebody, what emotion they need to work on, or something in their life they need to change, it's so varied.
Yeah, it's very true because it is simple and easy, but that doesn't always mean it's straightforward.
It's not straightforward. Yeah.
Yeah. For each individual, it's different. But yeah, it can be much simpler than everything else that you've probably tried and it isn't working.
Yeah. And also, because I do couples work, I'm really interested in the connection between relational dynamics and what's, and helping people develop more security and safety in their relationship, and then how that plays into people having more security and safety with their own bodies, and also vice versa. I think there's a big connection there. And I've learned so much about that through my relationship with my wife, who's just incredible partner. There's so much interesting stuff there.
I wanna dive into that. I know this could be a whole other episode, but let's dive there because I think that's so important, and, I don't really hear it talked about a whole lot in this area of understanding, okay, relationships are a cornerstone of us being human. We are relational beings, right? And that's where we get triggered and activated a lot of times because the different hurt parts of us are activated in relationships, which could increase our danger response. I think that, yeah, this is a really important topic. So my question is, uh, well, I have a couple. My first one would be, how do you find working with couples? Maybe there's one person that has symptoms, or even an individual that you're working with that maybe is talking about the relationship. Do you find that they need to, like, something has to change in their relationship for them to get out of pain or symptoms?
And my answer to all this stuff is just it depends, Every situation is different. I mean, it certainly can help if people sometimes yes, sometimes no. The connection, I think about pain as being your brain's like danger system. And that there's a lot of connection there to the whole idea of attachment, which is a whole nother topic. But how our brain is wired in relationship with our primary caregiver. And what you want in a good relationship with the primary caregiver is for the baby, the infant to experience like that when it cries, when the baby's in distress, that there's a response. There's a contingent response. And it's not like 100% of the time. It's sort of good enough, but that the response from the caregiver is not like making the danger alarm cry worse. And so that's a key thing with couples is helping people because when you're in a couple relationship, all of that kind of circuitry that was laid down in the primary relationship with the infant gets sort of repurposed for how you relate to your partner. So helping partners be soothing and supportive to each other, and then importantly, helping them interrupt those predictive threat patterns, which are just totally normal. But helping, often people will sort of go into those kind of threat states with each other and helping couples find the key to like step out of that. It's almost like a neural circuit, how to step out of that neural circuit and into a way of relating that's more, where people are sending signals of safety to each other. Uh, I've certainly seen like where it's a key part in people's, pain journey is, and especially if someone has a willing partner, it can be so helpful to have somebody who can take the pressure down and listen for what the emotion is underneath the pain, even if it sort of feels like it's delivered in a way that somebody doesn't appreciate to really what is your partner trying to tell you underneath that?
Underneath
So
the pain, you're saying?
yeah, like underneath, like just for example, like maybe I was working, this is very common, but I had a couple where she would have backaches whenever they would go visit the in-laws
Mm,
and her back would go out. So like what's the message underneath there? And it was something around like I'm 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 feeling alone. I need more support from you, husband, when we're with your family because I'm feeling not protected. So
yeah. I think that's actually a really great example, which I would assume does happen quite often. And then I'll even highlight too that that relates to what we were saying around pain can be a mechanism to actually get maybe some of your needs met. So maybe the pain allowed for a little bit more attunement from the partner. I don't know. I guess it could go either way depending on how the partner responds, but maybe it's the pain that is it's the asking for that, speaking
yes,
up.
right. It's asking, and and this, and then you sort of look at well, what could help you verbalize that more so your husband can respond, can really hear you.
Mm,
And what's the history around that's scary for you to do that? And then husband, how can you respond to your wife more so that it doesn't need to come out in this pain?
yeah. Yeah.
Yeah.
That's a great example. Yeah. Yeah, I think the couples work is really interesting in how you're blending it in a way because it all goes together. I mean, pain work is yes, we have to understand what's going on. There's an education around it that's really helpful, right?
Mhm.
Understanding the mind and body and nervous system connection. And at the same time, it's really just a mechanism for self-work, for understanding yourself better, understanding your patterns, relationships. It can be a whole transformation if you go there and let it.
On some level it's about learning to be kinder to yourself, learning to listen to your body more, learning to be kinder to yourself, and that's only going to allow your relationships to be better too if you're kinder with yourself.
That's one of the places I see people I don't know about you, but I see people getting stuck in their journey when there's still a lot of this looping of putting a lot of pressure on themselves, self-criticism, not being where they think they should be, all the shoulds and the coulds. When
Yes.
there's still that programming, that looping going on, I see people get stuck in their pain.
Yeah, I totally know what you're talking about, Grace. I have a couple people like that right now. The metaphor I was using, it's a little bit like if you have to go to the bathroom and you're like holding it, and then you like see the bathroom, and then it's the last little bit is so hard because you can see it and you're so close. And so I do find that with a lot of people can get percent better, and people talk about getting 95% better. And that last little bit of just learning and being, it really requires like patience and really being patient and accepting of yourself and accepting of the symptom and not and sort of giving up on like trying to make it go away, and then it can often go away, and it just takes time. And there's a saying they use in pain reprocessing therapy, like it takes as long as it takes for your brain to learn that it doesn't have to be afraid, and that can just take as long as it takes. Well, and I think when it's taking longer, I think it usually means that there's something more for you to learn there. If you can think back to when the pain started, that's often a really fruitful thing to go really examine that back to when it started and then when it amps up now in your life. What are the themes there? And often if the pain is not completely going away, you've addressed a lot of it, but there's some little piece there and it might be a change in your life. It might be some emotion that you haven't quite addressed, and sometimes it takes a little while to feel your way into what that is.
Yeah, it does. Well, as long as it takes is a great saying. We have to remind ourselves over and over and over. And the compassion piece, the kindness piece is something I talk about all the time on here. I mean, I didn't just name my podcast Heal with Grace because it's my name. It's also a double meaning, right? We need a lot of grace and compassion in our
I
journey.
do. Yeah.
Yeah.
I started at Naropa, and one of the themes of our program there is Maitri, which is compassion in Sanskrit, and it's considered the foundation for the Buddhist spiritual journey, and it's really the foundation for healing. I think is self compassion, and it's the foundation for helping others is being able to have compassion for yourself, and not like it's not in a mushy, soft way, but in kind of a fierce way of like, I can be with this part of myself. I can be with this part of myself. This part of myself is also okay. And
Yeah. Yeah. I like that being with it in a fierce way.
yeah,
There's emphasis, there's intention, there's yeah, ferocity behind it.
yeah, yeah, and some fearlessness. It's not easy. I mean, I think often when, again, to go that extra mile and really sort of like get there with your recovery, there's often some part of yourself that you're afraid of facing,
Mhm.
that or some part of your life that you're afraid of facing, that your pain is sort of asking you to face. Usually people are up for it. I think people can face more than they realize.
Mm.
I think the demons are scarier than, they really are when you face them. I do want to encourage people, like, if you're still dealing with pain and you haven't healed yet, just keep going and keep having patience and softness with yourself and try something else. There's all, if one therapist doesn't work, to try another one. There's all kinds of things out there, and there's different things that click for different people. And it really is finding that thing that clicks, which from my perspective would be that thing that helps you feel safe, that thing that helps you feel less fear around your symptoms, whatever that is. But I do think it's there for the vast, I want to say three vast majority who are dealing with persistent symptoms.
Yeah. I think that's a really wonderful place to end that. Keep going and do it with
Yes.
lots and lots and lots of compassion and lots of kindness to yourself.
Yes. Yes.
Yeah.
Yes.
Yeah. Thank you so much for this conversation. I think this will
Yeah.
be very, very helpful
Yes.
for our listeners. And before we end, speak to a little bit around what you're offering right now and how people can find you.
Yes. So people can find me on drmichaeldow.com, not to be confused with drmikedow.com, who's another psychologist who's not me. Or you can email me at michaelmdow@gmail.com. I do health coaching with people all around the country and even around the world. And then one of my passions, as you know, Grace, is creating community and bringing people together. So I do have I have our consult group, and I'm trying to start another one as well. Anyone, and this is open to health coaches, health professionals, anybody working in the neuroplastic symptom space who's wanting some more support and consultation and peer connection. This work can be a little bit lonely as a practitioner. You can sort of feel like you don't have colleagues. And I think there's so much synergy in sharing resources and talking with each other. So that's another, I welcome people to contact me for that.
And I'll have it all linked below. And yeah, I can echo. I am in one of your consultation groups right now. It's been great to share with people and to get feedback and to just connect.
Hmm. Yeah. Yeah.
Awesome. All right. Well,
Okay.
thank you
Thank you
so
so much,
much.
Grace. This was fantastic. And I just want to say, it's so great. I really, so great that you're doing this podcast, really, truly, and just putting it out there every week or every 2 weeks or however often you're doing it and getting the word out there. So important.
Yeah, that's the mission. Just get people thinking about it, right? Just
Yeah.
get it out there. You don't have to suffer forever.
Yeah.
Yeah.
Yeah. Totally. Like recovery, we just know. We know that recovery is possible for a lot of people. We can't 100% say it's everybody, but we just know because we've seen
Yeah,
it.
exactly. All right.
Okay. Thank you,
Thanks
Grace.
everyone.